Howdy guys, we're doing great, moving right along here. The next section that we're going to deal with and give you an orientation to is the cerebrovascular disorder section. Now, what we're talking about, basically strokes. Um, but when we talk about cerebrovascular disorders, they basically break down into two major categories. Those that are ischemic, whereas there's not enough blood flow to the brain, and those that are hemorrhagic, whereas there's a rupture of some vessel in the brain. Either that vessel is an artery or it's a vein, but there's some sort of rupture. The ischemic one is when there's not enough blood flow because there's some ineffectual, there's blockage, the pressure's too high, the pressure's too low, something like that. So ischemic and hemorrhagic categories are what we're going to deal with when we really dig deep into the art of neurology. When we talk more about the ischemic variety, what we'll be looking at are those that are global ischemic, such as involving blood pressure that's too low or too high. We'll talk about those that are focal cerebrovascular problems, a particular vessel that is either blocked, that is generally going to be blocked, might be a large vessel, might be a small vessel, but we'll talk about the focal cerebrovascular, either small or large vessel strokes. And then the third category that we're going to talk about are those that are cardioembolic, those that actually come from the heart, a structural abnormality or a rhythm challenge. The structural abnormalities, they tend to be what we call patent foraminal valley or a valvular problem. And then, of course, more commonly, paroxysmal atrial fibrillation. We'll deal with those because they all definitely have a different approach in terms of the prevention going down the road. And they have some slightly different implications in the intermediate phase once a patient has a certain type of stroke. So those are the ischemic variety of strokes that we're going to be talking about. Now, when we talk about those types of events that people experience that are hemorrhagic, what we'll be dealing with are those that are traumatic. For instance, get hit in the head with the baseball bat, especially on the side, and we can injure not only the skull but an artery that's within the skull. So a traumatic event if we're of advanced age and if we're going upstairs and then just stumble and hit our head on the door rail. We can experience a rupture of certain veins and have what's called a subdural, a traumatic event, not even major trauma. Or even if we have, let's say, a fall on a sidewalk and then we have a small area of bleed, it's called a contusion. We'll talk about those traumatic events. We'll talk about those that are not due to trauma and more spontaneous. Middle-aged lady, let's say, hypertensive. I'm just giving you kind of a typical picture, plus minus tobacco. We can have a spontaneous rupture of a subarachnoid, of an aneurysm and have a subarachnoid bleed. We can have, if our blood pressure is not controlled and if it's chronically suboptimally controlled, we can have a rupture of vessels and get an intraparenchymal bleed, or what we used to call a hypertensive or basal gangliar bleed. And then finally, sometimes when we're more advanced in age, we can have what's called an angiopathic type of bleeding situation. So we're going to talk about all of those types, the ones that are ischemic and those that are hemorrhagic. We'll talk about, when we talk about our hemorrhagic, those that are due to trauma, those that are not due to trauma, and then we'll talk about some that are more medical. Let's say we're taking a certain medication that increases the likelihood for bleeding, and we're taking it for medical purposes. Sometimes we don't have enough clotting factors in our blood itself, and we have what we have is a coagulopathy. And then sometimes we can have, let's say, lung cancer or stomach cancer. Different types of cancers, they have a tendency to go metastasize to the brain, to the gray white junction. That's where Mets go, and then they can actually have bleeding there. And so that is another way, sort of a medical type of bleed, as opposed to traumatic and non-traumatic. Now, aside from the ischemic strokes that we'll talk about and those that are bleeding strokes, we will deal with then the acute management of stroke. That's a big issue, and we're all focused on that. And so we'll talk about aspirin, of course. We'll talk about TPA, and then we're going to talk about thrombectomy. There have been some changes over the past several years. And then finally, we'll talk about the prevention of stroke. So lots of good stuff to talk about, lots of very important subject matter to cover when we dig deeper into the art of neurology. Hang in there, you're doing great. Keep winning.